Air. Nobody can live without it, but as human beings we continue to pollute it. If everybody in here takes a big, deep breath in, the air is clean. Now transport yourself to Rwanda. You're in a small room, no larger than the size of a privy, and the door is closed behind you. You're bent over a stove cooking. The air is thick with smoke, and you're suffocating, and your eyes are watering. This is the case for many women in Rwanda on a daily basis, and over half the world's population, but is seen as a necessary evil to provide food for their family. However, they are presented with significant health consequences, which are comparable to that of smoking. Past interventions have been criticised for not being culturally appropriate or health targeted. To develop an effective intervention, we need to define the problem and the health effects and look into potential effective solutions. So the problem, in this case, is biomass cooking of wood, dung and charcoal. These produce microscopic dust particles called particulate matter, which reach deep inside the lung, and carbon monoxide, which affects the oxygen carrying capacity of the blood. We need to understand how, what, where and when these pollutants are produced to understand exposure. Carbon monoxide levels taken in the University of Rwanda canteen have shown to be 3 times higher than the World Occupational Health limit. The health effects lead directly from the problem, in this case include pregnancy outcomes of stillbirth, low-term birth, preterm birth, preeclampsia and high blood pressure. So to understand what health effects occur as a result of air pollution, we need to look at poor quality fuel use and the association of the occurrence of these health events. So what interventions work? Ventilation, education, improved cook stoves, fuel change. To investigate this, you need to review past interventions into those that reduce the level of pollutants and have the reduction in the health events, as there is no point rolling out an intervention that does not have the required outcome. So to summarise, we need to find the problem, the health effects and the solution to be able to drive forward policy change to create a health intervention.